And the number of cases hitting a near record high all across the nation. The Midwest hit especially hard.
So joining us now to talk about it this afternoon, our chief health editor, Dr. Partha Nandi. And Dr. Nandi, is this due to the increase in testing or is something else happening here?
Afternoon, Glenda. I think that some of it, of course, is because of increased testing, but I also think, guess what? It's getting colder out there. I mean, today is an exception. It's a crazy warm day, but in general, getting colder. So folks are inside, and they're congregating together. This virus is merciless, right? All it needs is for all of us to get together and then infect us. And also, we know that school's in session and lots of folks are also, getting back to physical work. And so I think all those reasons why we've had increased cases. But it's a warning sign. I've been saying it forever, that what's happening now is probably 2 to 3 weeks ago. So if we want to make a change in what's going to happen in a month, we have to do the right thing. And we know what those are. Mask up, distance, wash your hands. I did a story where this could hang around, this virus can hang around up to 28 days in some surfaces. So let's take it seriously.
Yeah, Doc, so important to follow those health guidelines. Now, we have reported Remdesivir is the first FDA-approved treatment for COVID-19, but that news is coming with some caution from the medical field.
Yeah, it's really pretty controversial, Alan, and frankly, I'm a little surprised too, because you may remember, both of you may remember, I did a story right here on 7 talking about Remdesivir and a big study with the World Health Organization that talked about a negative study, no change in hospitalization rates, no change in mortality, and then you get this approval. Here's the thing, though, what the company says and the FDA says is this, that there are 3 other trials that are better than this World Health Organization trial. And so because of that, they said we wanted to approve it. Before it was an emergency use authorization. Now anybody can get it that's over the age of 12 and 88 pounds in weight. So to me, listen, I think the silver lining here, the good news is that, hey, we got more options. But I don't want people to think this is a panacea. There's data that shows that it may not make a difference. So let's not put all of our hopes in it. It's more in the tool belt, right? We've got steroids, we've got this, but let's remember the main thing I cannot emphasize more is primary prevention. Let's not get it so we can beat this, right? And also when the vaccine comes, that'll be the step that we need to really prevent it. So again, not a miracle drug. I think a great step. Okay.
Okay. We appreciate your insight always, Dr. Nandi. Happy Friday to you. Thank you so much. If you have a coronavirus question out there for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter.